Healthy Athletes is a series of health initiatives in dental, optometry, audiology, and fitness, which is designed to help athletes become fitter and healthier and get better and feel better, giving them a better chance to win both on and off the playing field. I know some people think, well, summer games are supposed to be fun. Why are you pulling teeth and filling cavities? But when an athlete comes up to you later in the evening at the victory celebration and says, this is the first time in 10 years that my mouth is not hurt, I think that's a significant life improvement.
Every year we see about 800 athletes through our Healthy Athletes program in Opening Eyes, Special Smiles, Fun Fitness, and our Healthy Hearing program. And it's mostly athletes that have been really marginalized in terms of their health care. So this might be the first time that they're examined by a professional in that field. You know, the misnomer with Special Olympics athletes is that they have equal to or better health care than most people, and the truth of the matter is that our athletes don't have access to the same level of health care that most of us are lucky enough to have.
You know, once you get beyond the age of 21, Medicare will not cover dental. So dental becomes really one of the most important of the disciplines here, because the adult athletes have virtually no insurance coverage in this area.
So this is one of our most favorite projects that we put on. I mean, Special Olympics has this great reputation. It has these great athletes that everyone wants to be a part of. And so it's just great for these dental students and all these people that come to help to be a part of this project that brings so much to our lives, not only the athletes. Healthy Athletes does have a great effect on these students, and not only that they're able to work with them at that particular time, but once they get into the profession and are in their practices, they will feel a lot more comfortable in working with this population. In most training programs in dental schools today, the students receive little or no training in special needs populations. We're starting to see more of that in the training process in dental schools, but for the most part, they get little or no experience in this. So this is a great experience, and I think it's one of the reasons it's so popular.
This past summer, we had an athlete that came in. His name was Steve. He had a tremendous amount of problems with his teeth. He spent about 5 hours in the dental chair at our summer games. And fortunately, the dentists were able to treat and restore a bunch of the problems in his mouth, and probably saved him from extensive long-term disease by providing these treatments. This is a quality of life issue, not a who can play softball better, who can run on a track better. This is about feeling good as an individual.
The data is the data. The data shows that 64% of all people with intellectual disabilities either need glasses or new ones. 37% have some form of preventable tooth decay, which is a precursor to many more health conditions, which could be diabetes, could be heart disease, could be cancer. We will make it available to you an opportunity to come to summer games, even if your child has not advanced to the summer games from their local program, even if they're not slated to be in the track meet, to be in the swim meet, to be in the softball tournament. We want you to come to summer games, to go to the health center. We have these great professionals from the Dental Association. We have these great professionals from the optometry community, the audiology community, that are here to examine your child to help improve their health. And they'll do it at no cost.